Sarah, a 28-year-old woman, has been feeling persistently sad, fatigued, and uninterested in her usual activities for the past 6 months. She has difficulty sleeping and experiences changes in appetite. Additionally, Sarah often feels worthless and has recurrent thoughts of death. On assessment, the nurse finds Sarah's affect to be flat, and she speaks slowly with decreased motivation. Her medical history and physical examination show no significant abnormalities. Which of the following nursing interventions is the priority? A. Encouraging her to join a support group for individuals with depression. B. Monitoring her vital signs regularly to assess for any physiological changes. C. Engaging her in recreational activities to distract her from negative thoughts. D. Initiating a suicide risk assessment to ensure her safety. The correct answer is D. Explanation. In this case, the priority is to assess for any immediate risk to the client's safety. The presence of recurrent thoughts of death indicates suicidal ideation, making option D the correct answer. Initiating a suicide risk assessment will help the nurse determine the need for appropriate intervention and ensure the client's safety. Mr. Smith is a 65-year-old man who recently lost his spouse to a chronic illness. He presents to the healthcare facility with symptoms of depression, including persistent sadness, feelings of hopelessness, insomnia, and a loss of appetite. During the assessment, Mr. Smith reveals that he sometimes wishes he could be with his late spouse and expresses feelings of guilt over not being able to prevent the death. As the nurse plans care for Mr. Smith, which of the following therapeutic communication techniques is most appropriate to use? A. Providing advice and solutions to help cope with grief and depression. B. Encouraging Mr. Smith to explore childhood memories to distract him from current feelings. C. Empathetically acknowledging Mr. Smith's feelings and offering a non-judgmental presence. D. Suggesting that Mr. Smith focus on work or hobbies to avoid dwelling on negative thoughts. The correct answer is C. Explanation. In this case, the appropriate therapeutic communication technique is to provide empathetic acknowledgement and offer a non-judgmental presence, as described in option C. Depression and grief can be challenging, and it is essential for the nurse to demonstrate understanding and support without imposing solutions. This approach will help build a trusting nurse-client relationship and foster an environment conducive to exploring emotions and coping mechanisms. A 40-year-old man visits his primary care provider, complaining of various symptoms. He reports feeling persistently sad and hopeless for the past few months. He mentions that he has lost interest in activities he once enjoyed, and his energy levels have significantly decreased. He finds it challenging to concentrate at work and experiences changes in his sleep patterns, often having difficulty falling asleep and staying asleep. He also notices a significant change in his appetite, leading to unintentional weight loss. On further assessment, he denies any physical health issues. Which of the following clusters of symptoms is most indicative of depression? A. Weight gain, increased appetite, and hypersomnia. B. Feelings of elation, racing thoughts, and grandiose beliefs. C. Low self-esteem, feelings of guilt, and suicidal ideation. D. Difficulty breathing, chest pain, and dizziness. The correct answer is option C. Explanation. The cluster of symptoms described in this option includes low self-esteem, feelings of guilt, and suicidal ideation, which are common manifestations of depression. The other options describe symptoms of other conditions. Option A is characteristic of major depressive disorder, MDD, with atypical features. Option B is indicative of bipolar disorder, and option D suggests physical health issues, possibly related to a cardiovascular problem. Emma, a 22-year-old college student, seeks counseling services at the university's health center. She reports feeling overwhelmed, sad, and unmotivated for the past few weeks. Emma mentions that she used to excel academically, but lately, she has difficulty concentrating on her studies and has experienced a decline in her grades. She denies any physical health problems, substance use, or recent major life events. Upon further assessment, Emma's counselor notices psychomotor agitation and a negative outlook on her future. Which of the following symptoms is most likely associated with Emma's depression? A. Intense fear of social situations and avoidance of social interactions. B. Uncontrollable repetitive behaviors performed to alleviate anxiety. C. Loss of interest in previously enjoyed activities and hobbies. D. Disconnection from reality and disturbances in thought processes. The correct answer is option C. Explanation. The symptom described in this option, loss of interest in previously enjoyed activities and hobbies, is commonly seen in individuals with depression. Emma's report of feeling overwhelmed, sad, and unmotivated, along with her academic decline and negative outlook on the future, is consistent with a depressive episode. The other options describe symptoms of different mental health disorders. Option A suggests social anxiety disorder, option B indicates obsessive-compulsive disorder, OCD, and option D points towards symptoms of schizophrenia. Mary is a 55-year-old woman who has been diagnosed with major depressive disorder, MDD. She is currently experiencing moderate to severe depressive symptoms, including persistent sadness, feelings of worthlessness, and difficulty sleeping. Her healthcare provider decides to start her on antidepressant medication. Which of the following medications is a commonly prescribed selective serotonin reuptake inhibitor, SSRI, used in the treatment of depression? A. Amitriptyline. B. Sertraline. C. Venlafaxine. D. Bupropion. The correct answer is option B, sertraline. Explanation. Sertraline is an SSRI and is commonly prescribed for the treatment of depression due to its efficacy and tolerability. Option A, amitriptyline is a tricyclic antidepressant. Option C, venlafaxine is a serotonin norepinephrine reuptake inhibitor, SNRI, and option D, bupropion is an atypical antidepressant that acts on norepinephrine and dopamine, but not specifically on serotonin reuptake. A 30-year-old man who has been diagnosed with depression and is about to start antidepressant medication. His healthcare provider decides to prescribe a medication that primarily inhibits the reuptake of norepinephrine, with some weak effects on serotonin reuptake. This medication is also known to be effective for smoking cessation. Which of the following antidepressants is most likely prescribed? A. Fluoxetine. B. Paroxetine. C. Venlafaxine. D. Bupropion. The correct answer is option D. Bupropion. Explanation. Bupropion is an atypical antidepressant that primarily inhibits the reuptake of norepinephrine, with weak effects on serotonin reuptake. It is commonly prescribed for depression and is also indicated for smoking cessation due to its effects on nicotine withdrawal. Option A, fluoxetine, and option B, paroxetine are SSRIs, and option C, venlafaxine is an SNRI. These medications do not fit the description. Ms. Johnson is a 60-year-old woman who has been suffering from severe and treatment-resistant depression for several years. Despite trying multiple antidepressant medications and psychotherapy, her symptoms have not significantly improved. Her healthcare provider suggests electroconvulsive therapy, ECT, as a treatment option. Susan is concerned about the potential side effects. Which of the following statements by the nurse is the most appropriate response to address Ms. Johnson's concerns? A. ECT is known to cause long-term memory loss and cognitive impairment. B. ECT is a painful procedure that requires anesthesia and can lead to physical injuries. C. ECT is a safe and effective treatment for severe depression, and memory loss is usually temporary and improves with time. D. ECT is reserved for patients with mild depression, and we can consider other treatment options for you. Explanation. The correct answer is option C. Electroconvulsive therapy, ECT, is a safe and effective treatment for severe depression that has not responded to other therapies. While it is true that ECT can cause temporary memory loss and cognitive impairment, these side effects typically improve over time. It is important for the nurse to provide accurate information to address Ms. Johnson's concerns and help her make an informed decision about her treatment. A 45-year-old man with a history of recurrent major depressive episodes presents to the clinic. His healthcare provider suggests electroconvulsive therapy, ECT, as a potential treatment option for his current severe depressive episode. He is hesitant and wants to know more about how ECT works. Which of the following statements best describes the mechanism of action of ECT? A. ECT delivers high doses of antipsychotic medications to alleviate depressive symptoms. B. ECT uses electric currents to stimulate specific areas of the brain, leading to controlled seizures that can improve depression. C. ECT involves implanting electrodes in the brain to regulate mood and emotions. D. ECT is a form of psychotherapy that helps individuals identify and change negative thought patterns. Explanation. The correct answer is option B. Electroconvulsive therapy, ECT, works by using electric currents to induce controlled seizures in the brain. The exact mechanism of action is not fully understood, but the seizures are believed to have a therapeutic effect on certain psychiatric disorders, including severe depression. Options A, C, and D are not accurate descriptions of how ECT works. Emily is a 16-year-old high school student who has been showing signs of depression. Her teachers have noticed a significant decline in her academic performance, and she often appears sad and withdrawn in school. Emily's parents report that she has been sleeping excessively and has lost interest in activities she once enjoyed. She denies any recent major life events or conflicts with friends. As a nurse caring for Emily, which of the following statements is the most appropriate for assessing her depression and related symptoms? A. Are you experiencing any anxiety or panic attacks? B. Do you often feel angry or irritable? C. Have you considered using substances to cope with your feelings? D. Have you experienced any hallucinations or delusions? The correct answer is option C. Have you considered using substances to cope with your feelings? Explanation. Adolescents with depression may engage in substance use as a maladaptive coping mechanism to deal with their emotions. It is essential for the nurse to assess if Emily has turned to substances like alcohol or drugs to cope with her depressive symptoms, as this can have serious implications for her overall well-being and mental health. James is a 14-year-old boy who has recently been diagnosed with depression. His healthcare provider has discussed treatment options with him and his parents. They are considering psychotherapy as one of the approaches. Which type of psychotherapy is specifically designed to treat depression in adolescents and focuses on teaching coping skills and problem-solving techniques? A. Cognitive behavioral therapy, CBT. B. Psychodynamic therapy. C. Play therapy. D. Dialectical behavior therapy, DBT. The correct answer is option A. Explanation. Cognitive behavioral therapy, CBT. CBT is a well-established and evidence-based psychotherapy for treating depression in adolescents. It focuses on identifying and challenging negative thought patterns, teaching coping skills, and problem-solving techniques to improve mood and behavior. Option B, psychodynamic therapy, option C, play therapy, and option D, dialectical behavior therapy, DBT, are also therapeutic approaches, but CBT is specifically tailored to address depression and its associated symptoms in adolescents.